Are your feet sore?
Looking after Evelyn McAuliffe is a labour of love for daughter Anne and her husband Steve.
We chose to look after Mum. That's something that we took on ourselves. We're hands-on. Family is family.
They don't want to put her into a nursing home despite the constant job of dressing, feeding and looking after the 93-year-old and her dementia.
It'll confuse her. And I'd rather look after her because I think I can care for her better than they do in the nursing homes. Okay.
Evelyn McAuliffe has been waiting almost 18 months to get a taxpayer-funded home care package worth $50,000 a year.
You okay?
While she waits, Evelyn receives a lesser care package worth just $15,000 a year, which is managed by Catholic Healthcare.
So the package we get is...
When 730 spoke to Evelyn's family in March, Catholic Healthcare was charging more than $500 a month in fees. Were any of the fees and the charges explained to you at the time when you signed up for this package?
No, none of it at all. It was explained in layman's terms that we would be allocated a certain amount of money. Of that money, you can spend it on whatever you need to spend it on for the care of your mum. But no fees were ever mentioned.
Catholic Healthcare said its fees are transparent and clients have a choice of providers. Since the interview, it signed a new agreement with Evelyn. However, it still takes almost $5,000 of her $15,000 annual subsidy in fees. Here's how home care works. Elderly Australians who don't want to go into a nursing home can apply for a taxpayer-funded package, ranging from almost $9,000 a year for someone needing a little help to just over $50,000 a year for someone with high-level needs. That government subsidy pays for carers, cleaning and equipment. But instead of the money going directly to the person needing care, it goes to a middleman, a home care provider who manages the money and who can take fees of 30, 40, 50% or more. The government doesn't regulate those fees because it wants to promote competition, but others say most elderly people aren't capable of shopping around.
There are a range of different providers in the market. Some of the fees are very low, and we see that.
But they have to find them.
Well,
an elderly person who doesn't have family support?
Well, that's the way that the system works, and I think it's reasonable that there is a level of competition in the market. That's how you drive down the cost of the provision of care. I have been working every day with the aged care sector.
Right now, Aged Care Minister Richard Colbeck is under huge political pressure after thousands of coronavirus infections and more than 550 deaths in nursing homes.
It is a disgrace that this minister leaves the chamber when the Parliament is taking note of his statement.
Earlier this year, he defended the government's home care policy. But why not just say this is the percentage you can take in fees and cap it?
Well, that's not a regulatory framework that the government supports.
I'm hearing figures anywhere from 25% to 70%, but substantially higher than most people would think is reasonable.
Professor Kathy Eager is an aged care researcher who says few clients understand how the home care system works or the high fees charged.
The information on the websites are not clear enough, even if the older person needing services knows how to navigate that sort of technology, and a lot of people don't.
Peter Budden was a former fireman who lived with Parkinson's disease for almost a decade. When he was diagnosed with terminal cancer last year, his son Michael started to look more closely at his home care package.
Well, he was getting charged 58% of the funding he was getting from the government in administration fees. So when I discovered that, I felt that was obviously way too high.
Peter Budden's home care package was managed by Australian Unity, one of the country's biggest providers.
Dad was at a stage where he couldn't get up and down, so he was sleeping in this chair.
When Peter needed a special bed, Michael Budden says the company tried to delay the purchase and refused to tell him how much was in his father's account.
I took Mum to Australian Unity headquarters in Newcastle and basically confronted them, and they said there was $16,000 in the account. So after that, I sort of demanded that we needed the stuff by the end of the week.
Australian Unity declined an interview but said its fees included home visits, managing and coordinating Mr Budden's care, and that there is no record of a family visit to its Newcastle office. The $16,000 that was sitting in Peter Budden's account is what's called unspent funds. Around the country, these unspent funds now total over $1 billion in taxpayers' money. It's a windfall for home care providers because they can invest that money and keep the profits.
And do you think that's fair on the taxpayers paying that, yet the providers are keeping it and earning interest from it?
Well, that's one of the reasons that we want to reform the way the system works. We've currently got a piece of legislation in the Parliament to change the way that operates.
But at the moment, it's not going back to the Department of Health to help get rid of that waiting list.
But that's what we have to change the way the system operates to do that. We can't immediately drag that back.
Since our interview in March, the government put that legislation on hold and unspent funds with providers continue to grow.
We have to have regulations. It's like everything. There's boundaries and there's laws for everything, but there's no laws or regulations in here for this. It's privatised and it's an open market.
Maria Berry quit her job as a consultant at Australian Unity in Albury, New South Wales, after just 4 months. She says she was assigned too many elderly home care clients.
They're so desperate to get some form of help. A lot of them are isolated because we're in a rural area. They weren't looking at what was being taken out of their packages and what it was costing. They just wanted that help and support.
Maria Berry believes Australian Unity put profit ahead of care, something the company denies.
If I brought up conversations about my concerns and it was, well, this is a business, Maria, it has to be run as a business, which I understand, but it just wasn't right.
The main complaint that we're having from people that we've spoken to is that some home care providers are running it like a business rather than a healthcare service. Is that appropriate?
Well, it is a business. They're in the business of provision of care, and that's what the government's looking to see.
Come on, girl. Sit.
Michael Budden had to fight to get his father a proper bed, but the elderly man had just one night in it before he was transferred to hospital, where he later died.
My father gave a huge service to the community over his working life and also in his personal life, and the way he was treated in the end there was just quite sad.
I think we need to really question the basic idea. This whole model was predicated that we were going to introduce a competitive market and market forces would work. We already know that the system is failing thousands and thousands of people.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.